So we're going to be talking about safety, health, and risk management, topics that are very important for companies, topics that can cost an organization a lot of money if they are not careful with risk management. And so companies pay a lot of attention to this. And the better the policies, the better the care that they take in this area, the safer their employees are, and the better their bottom line is, and so everybody wins. So let's get started here. And let me share my screen. So here we go. Over 80% of workers in one survey ranked workplace safety more important than minimum wages, sick days, and maternity leave. So the main purpose of this chapter is to provide you with knowledge managers need to reduce workplace safety and health problems. The main topics we'll discuss is safety and the manager's briefing on occupational safety laws, what causes accidents, how to prevent accidents, employee engagement based on safety programs, workplace health hazards, problems and remedies, and occupational security and risk management. So 5 sections to this chapter: the supervisor's role in safety, safety laws and OSHA, ways to prevent accidents at work, workplace health hazards, and how to deal with them, and then prerequisites for safety plan and how to set up a basic security program. So the supervisor's role in safety is very important. So it is very important. Safety and accident prevention concerns managers for several reasons. One is the staggering number of workplace accidents. In one recent year, 5,190 US workers died at work, up from 4,800 the year before. And workplace accidents caused about 2.9 million occupational injuries and illnesses. Such figures probably underestimate injuries and illnesses by 2 or 3 times because a lot of people don't report it. So safety also affects costs and profitability of an organization. The top management's role in safety, we'll see that reducing accidents often boils down to reducing accident-causing conditions and accident-causing acts. Management's attitude is crucial, but telling employees to work safely is futile. Management has to take safety seriously, and employers should institutionalize their commitment with safety policy, publicize it, and give safety matters high priority. The supervisor's role in accident prevention is crucial. The employer has a primary responsibility for safety, but the local supervisor is responsible for day-to-day inspections and enforcement. So whether you're the manager in an IT department, whether it's a Fortune 500 company, whether it's a 5-person employee, whether it's an excavation site or a dry cleaning store, daily safety inspections should be part of your routine. As one safety recommendation put it, a daily walkthrough of your workplace, whether you are working in outdoor construction, indoor manufacturing, or any place that poses safety challenges, is an essential part of your work. What to look for depends on the workplace for which you're responsible. It could be as simple as an electric cord out of place that someone can trip on. It could be as simple as something that could fall off a wall. And then as complicated as chemicals, and so on and so forth. So the safety law and OSHA. OSHA is Occupational Safety and Health Act of 1970, and Congress passed OSHA to assure, so far as possible, every working man and woman, in the nation safe and healthy working conditions and to preserve our human resources. The only employers it doesn't cover are self-employed persons, farms in which only immediate members of the employer's family work, and some workplaces already protected by other federal agencies under other statutes. The act covers federal agencies, but usually not state and local governments. The act created by OSHA was created by OSHA within the Department of Labor. OSHA's basic purpose is to administer the act and to set and enforce the safety and health standards that apply to almost all workers in the United States. It has about 2,200 inspectors working from branches around the country. OSHA standards and record keeping, they operate under general standard clause that each employer shall furnish to each of his or her employees employment and a place of employment which are free from recognized hazards that are causing or likely to cause death or serious physical harm to his or his employees. Okay, so OSHA's mission is to promulgate, I can't say that word, promulgate detailed legally enforceable standards. So it doesn't just list standards, but it wants you to have how-tos. So employers with 11 or more employees must maintain records of and report most occupational injuries and illnesses. So an illness is any abnormal condition or disorder caused by exposure to environmental factors associated with employment. What the employer must report, like basically all occupational injuries and illnesses, anything that results in medical treatment other than first aid. So loss of consciousness, restriction of work, loss of work days, restriction of motion, transfer, anything that results in transfer to another job, any kind of on-the-job accident that results in death of another employee, or results in someone having to go get medical attention of any kind. So OSHA has these posters that must be put up of what constitutes an OSHA required reporting injury. So OSHA enforces its standards through inspections and, if necessary, citations. The inspections are usually unannounced, and they may conduct warrantless inspections without an employer's consent. They may inspect an authorized search warrant. OSHA takes a worst fit first approach in setting inspection priorities. So from the highest to lowest, imminent dangers, catastrophes and fatal accidents, employee complaints, high hazard industry inspections, and follow-up inspections or its equivalent. So the inspection begins when an OSHA officer arrives at the workplace. He or she displays credentials and asks to meet an employer representative. The credential must include a photograph and serial number. The officer explains the visit's purpose, the scope of inspection, and the standards that apply. An authorized employee representative accompanies the officer during the inspection. The inspector can also stop and question workers and take them in private to question them without the company representative. They can look at all types of violations, and in some areas pay more attention than some, as more than others. Usually they look at things such as scaffolding, fall protection, hazard communication, lockout, tag out, electrical disentanglement, respiratory problems. Then the inspector holds a closing conference with the employer's representative and discusses the violations and any citation or penalty. And they usually give a written report, sometimes on the spot, sometimes later on. They can impose penalties. These range from $5,000 to $150,000 for willful or repeat serious violations, but they could go as far as $13 million after a tragedy, such as BP Texas City plant, for example. So both employers and employees have responsibilities and rights under OSHA. Employers are responsible for providing a workplace free from recognized hazards, for being familiar with mandatory OSHA standards, and for examining workplace conditions to make sure they conform with OSHA standards. The employees also have rights and responsibilities, but OSHA can't cite them for violations of their responsibilities. Employees are responsible, for example, for complying with all applicable OSHA standards, for following all employer safety and health rules and regulations, and for reporting hazardous conditions to supervisor. They have the right to demand safety and health on the job without fear of punishment, and retaliating against employees for reporting injuries is illegal. Now, if employees do not comply with standards, they can be dismissed. Okay, it needs to be documented that they have refused, and then they can be dismissed. So what causes accidents? There are three basic causes of workplace accidents: chance occurrences, unsafe occurrences, and employee unsafe acts. So chance occurrences, such as walking past a tree just when a branch falls, are more or less beyond management's control. Okay, we will therefore focus on the other two. So unsafe conditions are mechanical and physical conditions that cause accidents. The solution here is to identify and eliminate these unsafe conditions. Unsafe acts, work schedules, and fatigue can affect accident rates. So accident rates usually don't increase too noticeably during the first 5 or 6 hours of the workday. But after that, the accident rate increases faster. This is due partly to fatigue and partly to to the fact that accidents occur more often during night shifts. So unsafe employee acts such as running while doing your efforts to banish unsafe conditions, but there are no easy answers to what causes people to act unsafely. So employers will have more breaks late at night. They will try to do things to help employees be safer in the later part of their shifts as well. So what are ways to prevent accidents at work? In practice, accident prevention boils down to reducing unsafe conditions and reducing unsafe acts. So reducing unsafe conditions, like the ones OSHA addresses in the employer's first line of defense, sometimes the solution for an unsafe condition is obvious and sometimes it is not. So job hazard analysis involves a systematic approach to identifying and eliminating such hazards before they cause accidents. Performing a job hazard analysis might involve looking at the situation and asking questions such as, what can go wrong? What are the consequences? How could it happen? What are other contributing factors? And surprisingly, while workplace injuries are declining, serious injuries and fatalities are not. So identify potentially high hazard events, then conduct job hazard analysis and implement preventive steps. Operational safety reviews or safety operational reviews are conducted by agencies to ascertain whether units under their jurisdiction are complying with all the applicable safety laws, regulations, orders, and rules. And sometimes companies will bring an outsider in who's a specialist to help them figure out what their danger points are and help them do a better job, rather than have OSHA come in and cite them. So they get firsthand expertise in improving their processes and ensuring that they are in compliance. And then personal protective equipment, getting employees to wear that PPE, like hard hats, is famously difficult. Wearability is important, and enforceability is crucial. So educating your employees, giving them rewards for compliance, and having really strong things in place to ensure that they comply is very important. So how do you prevent accidents and reduce unsafe acts? So while reducing unsafe conditions is the first line of defense, human misbehavior with short circuit events, even the best safety efforts. Sometimes the misbehavior is intentional, but often it isn't. Unfortunately, just telling employees to pay attention isn't enough. So first, try to eliminate potential risks, such as unguarded equipment. Next, reduce potential distractions, such as noise, heat, and stress. Then carefully screen and train employees to ensure that they are being safe. So in reducing unsafe acts through screening, the employer's aim is to identify the traits that might predict accidents on the job in question, and then test candidates for this trait. The employer then uses this to develop more precise screening and train for the job. Reducing unsafe acts through training. So safety training reduces unsafe acts, especially for new employees. You should instruct employees in safe practices and procedures, warn them of potential hazards, and work on developing a safety conscious attitude. OSHA standards require more than training. Employees must demonstrate that they actually learned what to do. The main aim of safety training is not to meet OSHA's training standards, but to improve the knowledge and skills and reduce accidents. Employers Also use various tools to motivate worker safety. Safety posters are one, but are no substitute for comprehensive safety programs. Employers should combine them with other techniques like screening and training to reduce unsafe conditions and acts, and change the posters often. Posters should be easily visible, legible, and well lit. Incentive programs are also useful. So OSHA has argued that such programs don't cut down on actual injuries or illnesses, but only on injury and illness reporting. So last night, we were making hobo pies. If you don't know what hobo pies are, ask me later. And we were cooking corn over the fire behind our house. And I couldn't find our cooking gloves that are silicone and they're very high. I don't know where I put them and I couldn't find them. So I had the long tongs and I was trying to turn the corn over, and I was very unsuccessful in doing this. And so I was reaching in and it was too hot. And so everybody around the fire last night started telling accident stories. And they're telling stories about so-and-so on this work site stapled his foot onto a roof. And they had to cut the roof out and rush him to the hospital to get his boot and, unstapled from his foot, and the nail had gone through his whole foot. And then someone else is talking about another accident. And they're talking about people losing fingers and losing toes. And it would just like turned into this gory story of accidents. And I'm like, how can a group of people around a fire know so many people who have lost fingers and toes and arms and, in one conversation? And the reality is that people have been so unsafe and there are so many accidents and employers are concerned. And so this chapter, guys, is a very, very important chapter because accidents are out there and they're numerous. My very, very first memory in life, I was not 3 years old. And it's a crazy, crazy memory. I was on the farm with my dad had taken me and my brother and sister down to the farm. My mom was busy with something, so my dad took all of us down to the farm for the day. And my brother and sister and I were jumping off of a pile of hay and sliding down, and we're having a grand time. And I was somewhere between 2.5 and 3 years old. And I jumped off a pile of hay and I jumped onto a pitchfork. Now, the size of a 2.5 to 3-year-old foot is maybe about this big, okay? And I jumped and the pitchfork went, okay, how do I illustrate a foot? But it went between my big toe and my second toe, okay? And it spread the bone apart all the way up to the joint, okay? And it went in between. So on a child's foot, the pitchfork maybe went into my foot about 1.5 inches, okay? And I don't know who rescued me. I know my sister screamed for help. That was my sister's role. She's 4 years older than me. And that was my sister's role in life, was to scream for help. I fell off of a boat in the ocean when I was 1.5 years old, and no one but my sister saw, and she screamed for help. They turned around and got me, and I was floating upside down. My diaper was the only thing visible. So that was another accident. I fell out of a car at 4 years old, guys, on the freeway. My sister screamed for help because she's the only one who saw me fall out of the car. Anyway, I've had several accidents. I'm a miracle child. But anyway, so that was a big accident, okay? And that, you know, a farm accident. And after that, my father instituted a bunch of safety rules on the farm for all the workers of where the pitchforks went and where the tools got put away and all of that kind of stuff. But anyway, in manufacturing, companies will do incentives, and they will do pay incentives if employees will go a certain number of days without an accident. And so they will have the posters out, they will have the training, they will have peer accountability so that you so that you help others wear the gloves and the goggles and the hard hats and all the safety equipment, and you help others stay accountable in being safe. And because everybody wants the incentive, everybody wants to get the bonus if you make it. So the company will do a bonus at every quarter. So if you make it to 90 days, you get an incentive. When you get to 180 days, every employee gets another bonus, and it's a bigger bonus. If you make it to 270, if you make it to 365, so there's bonuses along the way. And of course, if the company can make it to 2 years, to 3 years, those bonuses keep growing to ensure that the company, the employees, really, really hold each other accountable, because the managers cannot be there to enforce every minute of the day. So if they create a buddy system, if they create internal accountability, they will have a much higher rate of success in everybody keeping each other safe. So in reducing unsafe acts and fostering that culture of safety, this is what I'm talking about. If you can develop teamwork, good communication, a supportive environment, have good safety policy, establish good awareness policies, create employee participation programs. Companies try all sorts of programs to ensure that this can continue in a very positive way. So workplace health hazards and how do you deal with them? This now is dealing with chemicals, industrial hygiene, and air quality. So many workplace hazards aren't obvious. This is not like unguarded equipment or slippery floors. Many of these hazards are unseen. And typical here are temperature extremes, biohazards, such as mold or anthrax, ergonomic hazards, like misaligned screens, and so on. So chemical and industrial hygiene, OSHA standards lists and limits, exposure limits for about 600 chemicals, such as asbestos and lead. And managing such hazards comes under the area of industrial hygiene. So it involves recognition, evaluation, and control. This typically involves conducting plant and facility walk-around surveys employee interviews, record of reviews, and reviews of government and non-government standards. So once a manager identifies a possible hazard, evaluation involves determining how severe it is and eliminating or reducing the hazard. Companies have tried to eliminate asbestos exposure, and this is one of the big areas that we have struggled with in compliance over the decades. About 2/3 of people with an alcohol disorder work full-time. So alcoholism and substance abuse are of great concern in the workforce. Some estimate that almost 13 million workers use drugs illicitly. About 15% of the US workforce has either been hung over at work, been drinking shortly before showing up for work, or been drinking or impaired while on the job at least once in the previous year. Employee alcoholism may cost US employers about $226 billion per year, and it results in high absenteeism and accidents. Deaths from opioids about tripled in one recent 5-year period as well. So dealing with substance abuse often involves substance abuse testing. Many states have mandatory random drug testing for high hazard workers. There's a lot of debate about whether drug testing reduces workplace accidents. A combination of pre-employment and random ongoing testing has been associated with significant reduction of workplace accidents. With a tighter US job market and more states legalizing marijuana, many employers are ratcheting down their drug testing programs, at least with respect to marijuana. And it's a very, very highly debated thing in the workplace. Dealing with substance abuse is truly debated in America today. So ideally, a drug-free workplace program includes 5 components. 1, a drug-free workplace policy, supervisor training, employee education, employee assistance, and consistent drug testing. So pre-employment drug testing discourages those on drugs from applying for jobs there or coming to work for employers who do testing. Pre-employment testing pick up only about half of workplace drug users. So ongoing random testing is advisable. Disciplining, discharge, in-house counseling, and referral to an outside agency are 4 traditional prescriptions when a current employee tests positive. Many things about one's job can be stressful. These include belligerent bosses or colleagues, work schedule, pace of work, job security, route to and from work, workplace noise, poor supervision, and arrogant customers. So personality affects stress. Human consequences of job stress could be anxiety, depression, anger, cardiovascular disease, headaches, accidents, and even early onset of Alzheimer's. So reducing job stress, there's a lot of ways to do this. Getting more sleep, biofeedback, and meditation are things that people talk about, but finding more suitable job, getting counseling, planning and organizing each day are other options. Employers and supervisors play a role in reducing stress as well. And, you know, burnout is a serious problem at work. It manifests itself in irritability, discouragement, exhaustion, cynicism, entrapment, resentment, and employee depression is a serious problem in the US and costs employers $17 to $44 billion per year. And depression actually increases accidents. So we're back to the accident theme. So another workplace health hazard is computer-related health problems. So ergonomic problems such as the desk, people who spend a lot of time at a desk, and workspaces not being designed properly for the person. So employees should take 3 to 5 minute breaks from working at a computer every 20 to 40 minutes and do other tasks, and design maximum flexibility into a workstation so it can be adapted to the individual operator. Reduce glare. There's so much that needs to be going into this. Put the screen at or just below eye level, at a distance 18 to 30 inches from eyes. Wrists need to be adjusted. Your feet need to be at a certain angle, certain floor rest. And I can tell you my desk is completely inadequate for my space, for my body. It's pretty bad. But there's serious problems here. Infectious diseases, employers can take steps to prevent the entry or spread of infectious diseases. We've become very aware of this with the pandemic, but there is a need to clean work area surfaces and to practice hand hygiene and to stagger breaks. So making sure that our areas stay clean. And then finally, workplace smoking. Smoking is a serious health and cost problem for employers. And it costs companies higher fire insurance and higher health insurance and increased absenteeism. So, and then employees who smoke take a lot more breaks as well. So you get less productivity. Workplace health hazards are, and then how to deal with them. So workplace safety relates to risks of injury or illness to employees. Workplace security relates to protecting employees from internal and external security risks, such as criminal acts by visitors and terrorists. Workplace security plans should address tasks such as establishing a formal security function, protecting the firm's intellectual property, for instance, through non-compete agreements, protecting against cyber threats, developing crisis management plans, establishing theft and fraud prevention procedures, preventing workplace violence, installing facility security systems. You've got enterprise management, risk management, so the process of assessing exposures to loss within an operation and determining how best to eliminate, manage, or otherwise reduce the risk. So you've got internal preventable risks and you've got strategies that you need to establish to reduce those risks. And then you've got external risks that you need to deal with. Preventing and dealing with violence at work. Violence against employees is one internal preventable enterprise risk and a huge problem. According to OSHA, homicide is the 4th leading cause of fatal occupational injuries in U.S. customers. And U.S. customers are often the perpetrators. Many other assaults involve coworkers or a current or former partner or spouse. You have Risk Management Magazine estimates that about 86% of past workplace violence incidents were anticipated by coworkers who had brought them to management's attention prior to the incident actually occurring. Yet management usually did little or nothing. Heightened security measures are the first line of defense, whether the violence is from coworkers, customers, or outsiders. I worked at a school where we took in a lot of returning military that had PTSD. And we also, at another school, we had a lot of single moms or recently divorced parents and a lot of parental disputes. And we had a view book for the receptionist. And our school the front door was locked. So employees and students came in by swiping their cards. And so if you didn't have a card to come in, you spoke at the desk, you spoke through a window. And the receptionist had a view book of people who were not allowed in. And she had to really memorize those pictures. We had tons of people who had restraining orders and we couldn't let those people in. And she was trained with a taser because late at night, we had issues with our night classes. And I taught there for 6 years. And in the 6 years, we probably had, 4 or 5 incidents where she had to use a taser on someone who had broken in and was going after one of our students. It was a rough environment. It was very interesting. And so our receptionist was trained and had a taser for her protection and for the protection of others. And it's a pretty interesting situation to be exposed to. When we did our safety check of the building at night, we always went through the building with 3 people. And she had the taser, but we always had 3 people, and we had a walkie-talkie and a cell phone. And so the front door was locked, and then we went through every room in the entire building and double checked the security. And then we walked out to our cars and drove out of the parking lot together to ensure that everybody left the premises safely. So some work environments are not as safe as others. And you want to make sure that you are taking care of your workers. So you improve employee screening, you establish zero tolerance policies toward workplace violence. We had one classroom where a student pulled a gun on a professor. not on my campus, but on a different campus. You use workplace violence training. You train everybody on what to do. You have guidelines for firing a high-risk employee and what to do. I've worked in environments where if you fired someone, if you were going to fire someone, you had security there, and security walked the person to their car and followed them off the premise, off the property of the work environment. And then you need to have policies for violence towards women at work. And today it's violence toward anyone at work, not just women. But homicides account for 10% of those who died at work in one recent year. Men have more fatal occupational injuries than women, but for the proportion of women who are victims of assault is much higher. So the Gender Motivated Violence Act, part of the Violence Against Women Act, imposes liabilities on employers whose women employees become violence victims. So we need to be very cognizant and careful in those. Securing the facility. This is what I was talking about, ensuring that there is a high level of security. If employees are there late at night, ensuring that there is a security level, ensuring that there is security on premises for walking out employees late at night and such, so forth. Employers can take several steps to protect its employees and physical assets from the risk of terrorist attack. These steps are now familiar in many workplaces, and they include screen the identities of everyone entering the premises, check mail carefully, identify ahead of time, lean interim crisis organization, identify in advance under what circumstances or conditions you will close the company down, as well as shut down process, institute a process to put a crisis management team together, prepare evacuation plans and make sure exits are well marked and unblocked, designate an employee who will communicate with families and off-site employees, identify an upwind off-site location near your facilities as a staging area for all evacuated personnel, designate and in advance several employees who will do head counts, establish an emergency text messaging procedure, secure the employer's physical facility, may do little to prevent cyber attacks. So being aware of that, data protection and cybersecurity are specialized areas requiring special expertise as well. And then you do need business continuity and emergency plans. One source estimates that 40% of companies never reopen after suffering business disruption from a major catastrophe. So putting a disaster plan in place is imperative. So develop a plan, identify key responsibilities, make sure all employees are aware of the plan, and train employees regularly. So those are some pretty important plans and steps to take into account when you are looking at safety, health, and risk management for a company.